done that, and I'm just about to give you the hosting back again. Okay.
Thanks.
So we're now recording this session. Thank you very much, John and Erica. Could I ask you to introduce yourselves, and then we'll ask Helen and Erilee, and then anybody else who joins us, and Yaya, to introduce themselves. So over to you, John and Erica.
Okay, my name is John McLean, and I manage the Mental Health Education and Employment Service here at Hackney Community College.
My name is Erica Thompson, and I'm the Mental Health Education and Employment Advisor on the service.
Okay, and Helen, do you want to go next?
Yeah, my name's Helen. I'm a Learning and Employment Support Officer with Haringey Learning Service.
And Erilee, are you back? No sound from Erilee, so we'll try her again in a minute. Yaya, do you want to introduce yourself?
Yes, my name is Yaya Sterland. I worked with Katina at NIAS, or what is now Learning and Work Institute. I'm now freelance, but supporting Katina with organising these events and some other work, and we'll run a webinar around refugees and mental health in April.
Thank you very much, Yaya. Now we've got somebody on the telephone, so I wonder if you want to just say hello.
Hi, it's Louise from Holston, and I apologise. I can't use the Zoom on our computer, so I'm having to dial in. If you can hear me,
we can hear you perfectly, Louise, and if you can hear us, that's great. Are you able to see the screen as well?
No, I can't. No.
Oh, okay. So you're just going to be listening, and I can see that Brenda's just joined us. So Brenda, assuming, firstly, I'm looking at the ceiling, Brenda. So you might just want to bring your camera down a little bit. If it's a laptop, just move it slightly. Otherwise, we've got a lovely picture of the top of your head and your lampshade. I'll give you a moment to do that. But if your microphone's on, Brenda, do you want to just introduce yourself? Okay, we'll come back to you. We'll come back to you, Brenda. Johnny, can we ask you to introduce yourself now?
Hi, Johnny Cunningham from Redbridge.
And can we come back to you, Brenda, then?
Hi, everyone. I'm Brenda. I'm from Learning Curve in Wiltshire.
Okay, that's brilliant. Welcome, Brenda. I think this is one of your first ones, isn't it? Okay, that's great. And I can see that Jessica has just joined us, so this is really good. Jessica, could we ask you to introduce yourself?
College, and I run the mental health research project for Katina, and I've done outreach for 9 years, and we're using the GROW model as part of our IAG at the moment.
That's great, thank you. I can hear a phone in the background, so whoever's got the phone wants to just mute themselves, unless it's John. And Brenda, I'm just going to try and unmute you again for you to introduce yourselves. Or did you? And I've got confused now. You did. So I'm not going to unmute.
Yeah.
Okay, no, it's fine. Okay, that's wonderful. So I'm really pleased to see people. I genuinely think that John and Erica have some really useful information for those of you who are pilots around the guidance offer and the signposting of kind of people, but also because I know that many of you have said you're not sure what you do with people who've got more severe and enduring mental health problems when you can't accept them onto our pilots, and you're not sure where to signpost them to. So I'm sure they'll be helpful for that. But they have had a look of what you said you wanted out of the session. So without further ado, over to John and Erica from Hackney.
Thank you. So thank you very much for joining us for our presentation. Good afternoon. We are from Hackney Community College, which is in North East London, and we are going to talk to you about our service, the model and the partnership with the local East London Foundation Trust, NHS. So as Katina said, we did have some strange sounds coming across there. We did have a look at people's comments, and we really hope that we're going to meet what you're interested in and what you're looking at and why you're with us today. So what's really important to say as well is we've been supporting local residents in and around Hackney who have mental health needs, who access education training since 1997. Okay. So we've just introduced ourselves. My name is Jennifer Thompson and my manager, John McLean. I'm going to take you through the first part of the presentation, and then John will take over halfway. Okay. So we thought that this was a really important a case study to start with. Tom was a student who accessed the service a couple of years ago. When we first met Tom, he was he has a diagnosis of paranoid schizophrenia, and he was residing on the ward. He felt incredibly depressed, wanted to die, and felt very, very worthless. So when we met him on the ward, this was at Homerton Hospital, the local psychiatric wards. Tom had been in and out of hospital for over 25 years, and that's on and off of medication. So as I said, he felt incredibly worthless, and also that was unfortunately compounded by the professionals who were caring for him. We met Tom on the ward. We did the initial assessment with him. We found out what it is he wanted to do. Tom said he was interested in learning a trade. So from meeting Tom on the ward and at the community mental health team, and then slowly Tom came to the college. He did his English and maths assessment. Tom was assessed, met the tutors, and he was enrolled on a plumbing course. So throughout Tom's time on his course, we met him frequently, liaised with his tutors, met with his care team, and Tom did really well and progressed on to level 3 of his course. I think it's really important to mention that throughout Tom's time of being a student at the college, he had no further admissions and was discharged from secondary care services. Tom is such a success story for us because Tom is no longer considered to be a service user, but he's also employed by British Gas as an engineer. So it's a really, really nice story. So here you can see a bit more about the context of mental health in Hackney. You can see that Hackney has one of the highest prevalence of mental health in London, which is far greater than the national average in England. It's also important to highlight here, we're talking about severe and enduring mental illness. So we're talking about diagnoses such as Tom's, schizophrenia, bipolar, personality disorder. We do also, that's where the majority of our referrals in the service come from, but we do also work with primary care services, local IAP teams, GPs, where our kind of mild to moderate referrals come from. Okay. Does anyone have any questions at this point? Okay.
Yes, sorry, I did. Could I just ask quickly about the initial assessment? Did you do that in the ward?
Yeah, we do.
You probably can't say exactly, but kind of briefly, what does that look like,
yeah.
Erica?
So our initial assessment, we give information, advice and guidance to people whilst they're on the ward or when they've been discharged at their community mental health team, as well as the general cohort students in the college who have disclosed mental health needs. So that involves going to the wards on a weekly basis. The OTs at the wards book in patients on the ward who have expressed an interest in either returning to education or wanting to explore their employment or next step options. We meet with someone on the ward, we look at what it is they've done previously, what they want to do in the future and what their support needs are. Then we'll go back the following week or a couple of weeks later, we'll meet with them again, we'll do some follow-up work depending on whatever it is they've told us. It might be that by that point this person's been discharged and they're now under the care of their community mental health team, so we might meet them at one of the CMHTs in the borough. We'll meet them with their care coordinator, look again at, you know, kind of what they've said it is they'd like to do. And then it's about gradually, you know, meeting that person again. Then at the college, it might be then looking at the college's initial assessment, which is kind of slightly different from ours. So ours is more of a kind of action plan, if you like. The college's is the English and Maths assessment, the BKSB, which is done online. And that's for all students who are wanting to do a course at the college. And then once the student has taken that, we'll use those results in line with what they've said it is they'd like to do. And then we'll take it from there.
Thank you.
Okay, so then looking at our students and the college, so historically Hackney is one of the most economically and socially deprived boroughs in the country. 76% of our students are adults and 23% of our students are young people. Nearly all of our students at the college come from disadvantaged areas of the borough, and 66% of our students identify as BME, and over 50% of our students have English as a second language. So that just gives you a bit of context of our students in the borough. Also on that one, I just did want to say, I think it's also important to say that adults in Hackney fall below the London average for GCSE equivalent qualifications. This is probably best represented here, where you can see our students' journey. So many of our students start on entry-level courses, and then they progress on to the higher levels, level 2 and level 3. So you can see that over 50% of our students do progress on to further and higher education. So that's kind of illustrating that students will start on the lower level courses and then progress on to next level, as well as some of the HND, HNC courses that have been run at the college in partnership with local universities. Over 8% of our students do go directly into university, and over 11% of our students go into employment. Okay, so out of all the students who enrolled at the college, you can see that those who disclose is tiny. It's around 3%, and that's not going to be a surprise to anyone here. But what we do on our service is we try and work with people to enable disclosure. And what we think is really important is letting people know where their information is going if they decide to tick that box, and what will be done with their information. So we make our the service information, John and I, available on the website and in the college prospectus. So that's before people become a student. So if they like, they can contact us, or their care team can get in touch with us. We are available throughout the enrolment for people, and that's for people who've been referred to us previously, but that's also for people who come in during the enrolment, who disclose perhaps to a member of the enrolment team, and we can go and meet with that person and make contact with them. We have a VLE page at the college on our virtual learning environment. That's where staff and students can go and get resources around mental health and mental health awareness. We have a Facebook page. We run cross-college activities, so that's World Mental Health Day, Disability Awareness Week, Healthy Living Week, where we have key speakers come in, and we organise a variety of kind of events around raising awareness around people's wellbeing. We go into classrooms, that's throughout the year. We give talks on mental health awareness, how students can look after their wellbeing. We work very closely with our local community, that's the local City and Hackney Mind, also the local IAP team and the various mental health charities that are in the borough. And also we run staff training throughout the college, that's from the canteen and property services staff right up to senior management and all the staff in between. Okay, this is our slogan that anyone in East London may have seen on the back of our buses. This is what staff and students agree are Hackney Community College's values. So ambition, success and opportunity for the local community. So now I will pass you over to John to do the second part of the presentation. Any questions at this point?
Good afternoon, everyone. My name is John, and I manage the mental health service here at the college. And I'm going to take you through the next few slides. If you wish to ask any questions, please do, or raise your hand, and I'll try and come to you. So what we're going to cover in the next few slides are the aims of the service, why we're here, and what we do. We're going to look at our service model and how it works, the approach of the service, some impact data. We're going to look at some learner quotes as well as partner quotes from our local mental health trusts, our achievements, challenges, and then we'll look at our conclusion. Okay? So we're going to start off with our aims of the service. I think the most important aim is that we bridge the gap between mental health services and mainstream education for people with severe and enduring mental health issues. As Erica mentioned, we identify and address barriers to learning for people with severe and enduring mental health issues, and we do that at a variety of different stages. That can be in the initial assessment and right the way through the learning process, because barriers can come up at any point in learning. We facilitate access, support, progression into education, training, and employment, and I'm going to talk to you about that a little later with our service approach. So we provide in-depth, impartial advice and guidance and support. And I think it's quite important to mention the impartial part, because if we know there's a course that's cheaper and better suited to an individual elsewhere, we will tell them about that course and we will link them into that course and services and support services perhaps in where they're moving on to. We challenge stigma in a variety of different ways. I think Erica's mentioned the World Mental Health Day events that we do right the way through the college year. We support, advise and raise awareness around mental health issues with staff and students. I think Erica's just mentioned that. So we support students to recognise their potential and to remember what their hopes and dreams were and to reconnect with that in terms of, and that's really important in terms of recovery and the recovery model. And we work collaboratively right across services. Those services are not just externally, but they're internally. So we work right across the college. In particular, we've got a really good relationship with the curriculum, with the learning support team, registry, heads of schools. We work right across the mental health services in Hackney, as well as the forensic services. So we work with people with severe and enduring mental health issues who've committed crime. And rather than be in prison, they're in a locked institution locally. We foster those productive working relationships with key college staff, and that's really important, and a key driver in the service is to have that good relationships with your colleagues, and so that your colleagues know exactly what you do, how you can aid retention, achievement and success rates. It's quite important. We've developed good practice within the FE sector. We have reconnected with our colleagues across East London. So we have an East London mental health further education network, which consists of ourselves, Hackney College. We have Waltham Forest College, Newham College, Tower Hamlets College, and Islington College. And basically what that is, that we've linked the mental health advisors in those colleges. So we come together once a term, share good practice, etc. So moving on to the service model. This is the service model in its simplest of terms. As you can see, the mental health team, myself and Erica, are in the middle. And we kind of bridge the gap between the local mental health trust and Hackney College, because health and education speak two different languages. As you might know, success in health is not the same as success in education. So what we kind of do is we try to interpret that language. And we do that we have a steering group that meets once a quarter. That steering group has existed since the beginning of the service, and it's key to making this service work. In the steering group, we have senior members of staff from the Mental Health Trust. So we've got the lead occupational therapist for East London and social inclusion director. We have representation from the local borough, the local Hackney Borough. So we've the head of mental health and public health. And we've got senior management from here at the college. We have the head of student services and the assistant principal for student services that sit on this particular group. And they kind of they drive the service and we report back in terms of our KPIs. But it's really important to have that connection with the trust and to have that meeting on a regular basis so that the connection is not lost. Do you have any questions up to this point before I move on?
I'd be just curious to know how big those meetings are. So how many people do you get from the partners side, and also whether it is that you get those who attend to pass on the messages elsewhere, and how does that work?
Well, how it works basically, the people that we have in the network are at the top of their game. So we've got, as I said, the lead OT, occupational therapist for mental health in Hackney, and the head of social inclusion. So that's the top of their game in terms of the East London Foundation Trust. And it's really important to have someone at that level so that they can disseminate whatever information that needs to go down via their community teams. And as I say, at Hackney College, on occasion, our principal comes into the meeting, and as we've got the heads of student services and the assistant principal. Each meeting that we have, everyone attends. We rarely have a meeting where none of our partners attend. The partners always attend our meetings. Okay.
Well, I couldn't just ask, unless I missed it, how it's all funded.
Say again?
How is it funded?
We're funded. My post is funded by the East London Foundation Trust. And going back to what Erica said, this post was set up in 1997 as kind of a result of the Tomlinson report in terms of wider participation for people, and in particular for people with mental health issues. So I'm funded by the local mental health trust, and Erica's post was funded originally via the primary care trust, and then that moves across to the local authority in terms of public health. And when I talked about earlier the importance of the steering group, Erica's post was born out of the steering group. It was because we had decision makers at that meeting that we were able to get funding for Erica's post. And not just for Erica's post, we've also put on courses throughout the years specifically designed for people with mental health issues, funded by the local trust. So those connections are really important, and working collaboratively is really important with our partners. Okay? So this is the second part of our model. So what we do, our learners are at the center of everything that we do. We don't fit the learners. Whatever comes to us, we try to accommodate. So we've got really robust referral procedures with our partners. And that means basically that we have referral forms that are completed by whoever refers to our service. And in particular, that works well with our forensic clients. So we have a robust relationship with the local forensic services, with the local Jigsaw team, that's the police team, and the local MAPA service, which is the Public Protection Agency, which works really well. So that's for students, who are of the higher risk. In terms of our general cohort of students, our referral routes work in a variety of different ways. Students can refer direct to us or be referred by a care coordinator or one of the charities that we work with. So we offer a balance of on-site and off-site delivery. And what that means, I think Erica touched on it, on Fridays, because I'm employed by the Trust, I work at the Homerton Hospital in the psychiatric units, offering information, advice and guidance to inpatients. On Friday afternoons, I work with the local mental health teams. There's 2 in Hackney, and I offer a similar service. They will book their clients in to see me who are thinking about returning to education, training, or employment. And we work also with the early intervention services. So going back to our original aim, in terms of bridging the gap to people with mental health issues, I think it's really important that we actually go to people rather than expect people just to come to us. Because not everyone's able to make that step into a busy campus. We offer also collaborative initial assessments, and in particular that means if we have students with particular support needs or with particular risks, we will conduct the initial assessment with their care team initially. There's many others that we don't. We just do it on a one-to-one with the individual. And I think it's important to say that when we see people, we don't ask what their mental health condition is. That might sound like a strange thing to say, but they've come to us not to talk about their mental health in particular. They've come to us to ask for information, advice and guidance on training and support into education. More often than not, Eric and I will know what the condition is or what the diagnosis is. But I think it's important for the individuals that we see that we don't start off in that vein. We might ask how their mental health might impact on their learning. Are they good in the mornings? Is there side effects to medication? What support might they need in learning or in the classroom, etc. And we have a mixture of discrete and non-discrete learning in a mixture of provisions and locations. For instance, we have courses that run in the psychiatric unit at the Hamilton Hospital. We've got some of our courses run within community venues in and around Hackney, specifically for people with mental health issues. In Hackney College itself, we have a mental health cookery course that's run in partnership with the local mental health trust, mainly for inpatients. The trust provides the occupational therapist, and we provide the cookery teacher and the cookery kitchen. And basically what that's about is getting people off the ward and into education to start thinking about recovery and the what next. And there's a real high progression rate from that course onto mainstream learning. Erica and I will go in at different points of the year into this course to show our face so that students know who we are, and when they're ready to make that transition into mainstream, then we're available. Also, they make really nice cakes, so we often go in at different times when we know this cake's available. So those classes and our community classes, Eric and I will also go in and visit. So it's about bridging that gap for people.
John, we've got a question from Jessica. Jessica,
okay.
Oh, hello, John. I was just interested in the cookery class.
Yeah.
Because it links to something that happened yesterday. Is it just a rolling program, the cookery class, or?
It's a 10-week rolling program, yeah.
So can people, if they're still admitted, can they do 10 weeks and then another 10 weeks, or do they do 10 weeks and then progress on?
Yes, they can. It depends on the individual. Some of our students will do the 10 weeks and are quite happy with the 10 weeks, and then they'll progress on. Others might need a little bit longer. So I think the maximum they can do is 30 weeks across.
30.
And
yeah. Is it looking at cookery skills, or is it looking at that kind of food, the nutrition and well-being link, or is it looking at all of it?
It's looking at all of it, so all of that combined. And also it's about the social interaction, because what our students do is cook and eat. They've also produced their own cookery book with all of the recipes that they've collated over the periods. So our original cookery course created a book that our existing students use, and they can add to it. But it's also about the social interaction. It's having, because for some of our people, who are coming from wards, who might find it difficult to speak and chat and interact. So it's about building people's self-esteem and confidence and around social interactions and food. And also we embed literacy and numeracy into the course.
So this sounds a bit, how long, do you know how long the session is? Is it 2 hours or?
From 2.5 hours. It's from 3:30 till 6.
Thank you very much. Thank you.
No problem. Okay, let's move on. So this is our approach. So we have a three-pronged approach, we call it. So we, as we've just talked about, we have students access us and access college through a variety of different means, which we've discussed. In terms of success, in terms of supporting learners to stay on course, we'll do whatever that might be. We'll meet with individuals on a one-to-one basis. We'll talk and meet with tutors. We'll liaise with community teams. Whatever that might take in terms of helping the learner succeed, then we'll do whatever the learner wants, basically. Some people will see us in the initial stages, i.e. through the enrollment process, and then they'll dodge us in the canteen because they don't want to be associated with us. And that's fine too. Not everyone who ticks the box who's got a mental health condition has to come and see us. As I mentioned, I think I've said before, that it's very much a learner-led service. If you choose to use us, then you can come and see us. You don't have to. For some learners, we'll see them right the way through their learning and progress them and then support with progression. Part of Erica's role is Erica will help individuals move into the next level courses, volunteer work, work placements, employability, etc. And we try to break down the barriers at each of those 3 points. Do you have any questions on the approach? No? Okay.
Can I ask a question about your links with DWP? Do you have any? the Department of Work and Pensions?
We've got links with disability advisors in the Department of Work and Pensions, and also at Hackney College we have a welfare service. So if you have issues with their benefits, we don't directly we can't directly support people with their benefits, but what we can do, we can link them into a welfare officer, or we can link them into the disability advisors, that's the DWP.
So are they part of your partnership? I mean, when you talk about your partnership meetings, is DWP part of that partnership meeting?
No, the DWP are not part of that partnership meeting.
Right.
In terms of the partnership, the people who sit in the partnership are people who actually fund the mental health service here at Hackney College. The DWP don't contribute to this particular service, but we work closely with them, and we work closely with, I mean, we'll work with anyone really that have our individuals stay on course. I mean, we do have issues with the DWP. We've had clients who've been, and I think I'll talk a little bit later about some of our students who are being reclassified and work. So and put on work programs and taken off college courses. So that can be a bit of a barrier. But I'll talk a little bit later on.
Okay, thank you. Thanks.
So looking at the quality impact of our service, so these are the number of learners that we've supported into Hackney College over the last 5 years. These are not the number of people that we've seen in total, but it's just the number supported into Hackney College courses. So as you can see, last year, for instance, we supported 480 people into mainstream learning. Out of that 480, I would say 90% of the people have severe and enduring mental health issues, and 90% are studying across mainstream curriculum as opposed to mental health specific curriculum. You might notice a dip in 2011-12, and that dip was a result of the government, in their wisdom, decided to make some changes to the eligibility to courses for learners on ESA. Most learners that we see here on ESA are on a support component. The government made a change and said that only those who are on the work component can have concessions for courses. So we've seen a dip in that particular year. But we know, and following on from those years, we can see a rise. And we're seeing an increased amount of people actually coming forward and disclosing to us. Do you have any questions on our numbers? Okay. So this is some testimonials. One of our learners said that they had a great deal of encouragement from the team, and they may not have continued with the course without that encouragement. Another said that knowing that there was a specific service in the college that he could go to when he needed to was a real help. And I think that's really important, because we don't want people to depend on us. We're here to help people through those transitional periods. And if people can move on from us and study without us, that's good. And this particular student will come and see us once every 3 to 4 months, as and when he required. In terms of our partners, one of our local consultant psychiatrists said that he felt that we enabled many of his service users to participate in a society which they would have otherwise been excluded from. The borough director for the Mental Health Trust felt that what we do in terms of our work aids recovery for a lot of patients that are coming from the mental health service. And moving on to some of our achievements that we're quite pleased. I mean, I don't want to brag too much about this, but we're quite pleased about some of our achievements, not just for our mental health service here at Hackney College, but I think in terms of mental health and education right across the country. We won a Queen's Anniversary Prize Award in 2012. These awards are normally given to higher education as opposed to further education, so we were quite pleased. And this was for our support in widening participation to adults with mental health issues, access to education, training and employment. We managed to take 5 or 6 students with us, which is really nice. They got to meet the Queen. And the Queen of England asked the views on what they were studying, which gave them a real boost in terms of confidence, etc. And also I think it was a real confidence booster for the sector to show that further education colleges can and do win these prestigious awards. And in particular for mental health, it's giving a shout out to mental health. You'll see that we also in 2010, I think it was, we won an Association of Colleges Beacon Award. That was for widening participation for mental health service users. We have just been shortlisted for a Times Education Supplement Award under the category Supporting Learners. So we'll know towards the end of April whether or not we've been successful with that. In terms of Ofsted said that success rates have improved well for students with mental health difficulties. And I think it's important to say at this point that our success rate for students with mental health issues here at Hackney College is 88.8%, which is higher than the national average. I think the national average is 83%. And our success rates, retention and achievement rates are on a par with our regular cohort of students. Our last inspection, our college was awarded a good, which we were quite pleased about. And then, do we have any questions at this point, or can I move on to the next slides? No questions? Okay. So what we're going to look now at how we share our good practice. As I mentioned, we re-established a mental health network in East London, and we've shared our policies and procedures with our colleagues across the colleges. Most of our colleagues didn't have a forensic policy or forensic procedures. Most didn't have mental health policies or crisis procedures. So what we did is we shared our policy and procedures so the colleges could start to begin to create their own. Staff training, we offer staff training, Erica says, right across the college. And we also offer bespoke staff training. As part of the network, we're looking at developing an East London-wide FE training for staff so that we use the same model across our partners. Recently, we were published in the Mayor of London's and Minds Getting Ahead report, and that report was looking at mental health and employment in London. We were also highlighted as a case study by the Tavistock Centre in global research, and that was looking at examples of good practice and how we work with people who traditionally don't access education. Now here's some of our challenges, and I thought it's important to share some of the challenges because we don't want to sugarcoat this, that it's all wonderful and it's all good. Our funding has recently been reduced, which was a bit of a shock to us. And that translates into that we're losing Erica's post at the end of June. The local authority have decided that they're going to just claw back the money. We're trying to fight it.
Could I introduce I'm sorry, I know I've had lots of opportunities to do this and I haven't, but something that you just said there made me just think, have you tried writing directly to the new Health and Disability Unit at the NHS England?
Well, what we've done, we wrote in partnership with the principal. We wrote a letter to the Director of Public Health in Hackney.
Okay, I just think that the new unit is a DWP health unit. The contact I have there is Nick McGrewer from DWP, and bearing in mind certain changes of personnel in departments, probably as I'm recording, that's all I'll say. It might be worth just saying, you just want to draw to their attention that you've this legacy of work, that the funding's being reduced, and therefore can you make the information available to them, because you know it may not be around if you're not around. So I'm not suggesting you say, oh, we need money or whatever, but that maybe actually just pointing out to them this legacy might be really important for them to encourage others to take a look.
Sure. And well, could you, who would I contact there, do you think?
I'll send you an email afterwards.
Yeah, okay, that'd be great. Okay, great. So, I mean, that's one of our major challenges at the moment in terms of the service will be reduced. I think we just briefly talked about the changes to benefit entitlement. That's made a big impact for our learners. Learners are, as I say, learners are being reclassified, moved into work programs, taken off college courses. You know, our welfare service in particular do a lot of work with the job centre to try to encourage them to allow our learners to stay on vocational courses. Changes to funding in adult education, as you know, we're being cut year on year. That's had a real impact in terms of provision to our adults. Cuts to mental health services is another thing that's impacting our learners. For some of our learners who, are well, are being referred back to the GP surgeries and not being seen by community mental health teams, which can create a lot of anxiety for some of our people. The CAMS transition for some of the younger learners, moving from CAMS into adult services, can be traumatic, as there's not that wraparound support that they once received from CAMS. I think it's also important to say that Eric and I are funded to work with 18 plus, as opposed to 16 to 18s. However, we have seen, one of the challenges that we have seen recently is that we have seen a sharp increase in younger learners wanting to access service, self-harming, etc. So what we've done, we've developed a relationship with our local CAMS, and we have direct referral that's now to CAMS. So rather than Eric and I see an individual on a regular basis, we can create an intervention or a pathway to CAMS. So just to conclude again, to us, it seems quite simple in terms of the partnership, although it's not that simple because it takes a lot of work in maintaining the partnership. But essentially, it's to bridge the gap, it's to widen participation, it's to promote social inclusion for people with mental health issues, and to give people a chance to change their lives and get back into learning. And that's what we do in a nutshell. So if anyone has any questions, please feel free.
Johnny, you've got a question? Johnny, do you want to? I can see you've got a raised hand.
Can you hear me now?
Yep, that's fine.
Yeah. I was really interested in the East London network that you've set up. We're actually North East London, and I'm wondering whether you would be willing to widen the network to include other services. We're adult education in Redbridge, and we've got one of the national community learning mental health pilots.
Yes, I mean, of course. I mean, I think that's something we could actually we could discuss with our network to widen that, to widen the network to yourselves. I mean, I can't really see a problem with.
That would be brilliant, because we are the only pilot this side of London.
Sure.
So the team here, the mental health team here, that are working on the pilot, have done such brilliant work. They have made their links. For us, it's NELFT, the North East London Trust, but it's taking time, and I think there's a lot we could learn from yourselves, because you've obviously been working in this area for much longer than us, and it maybe would help us to make sure that we get at the highest levels that support from our trust. It's been quite difficult to get them to engage with our steering group. It sort of gets devolved down a bit, so it's not always your higher level decision makers that we'd like to see on our steering group. So we would find that interesting, that sharing of good practice.
I think that sounds like a really good idea, and the main reason that's the reason we set the network, or we established the network, is that I went out to meet with the colleges individually to say, look, this is who we are, this is what we do, and these are some of our challenges. Why don't we come together and try and kind of work through these together, share documents, share good practice. So yeah, that sounds like a really good idea. So we've got your email details, so we'll take it to our next meeting and then be in touch.
Yeah. And also, like, Julie, if you want to come and visit us at Hackney College,
we would.
You'd be more than welcome to come and visit us.
That's brilliant, particularly as the two colleges are now merging, aren't they? Redbridge College and Hackney. So although we're the adult service at the moment, of course, anything could happen with the area reviews, etc.
Yeah, that's true.
To see that. Thank you very much.
You're welcome.
Anybody else got any other comments or questions while we've got them there? Could I just ask you to, one of the things is that obviously the pilots, John, and I know not everybody that's here is from the pilots, so Helen, please, if there's something else you want to know, do ask. Obviously we're working with mild to moderate mental health problems, and we're defining that, not again like you, not by a diagnosis, but actually we do use a couple of the IAP tools for that. And then we also use the short WEMWIBS tool. And I know that at the meeting last week, lots of people are still very resistant to our use of those tools as a way of measuring changes in people's mental health outcomes. So if you don't use anything like that, how is anybody measuring the change in their mental health outcomes? I appreciate that measuring their learning outcomes, you're using similar methods to everybody else, but for their mental health outcomes, do you have a way in which you capture that?
Yeah, yes. That's really interesting. Actually, you should ask that, because I developed a wellbeing tool last year. So we worked with our one of the teachers who runs our mental health specific cookery course, and myself and John initially met to talk about some of the kind of throughout the year what we think some of those key milestones are for students in terms of, you know, confidence, meeting new people, learning new skills. And also it's about looking at the softer skills, because you know, in terms of at the college, and I know this will be for everyone here as well, the college measures those really hard outcomes. So it's about success, achievement, retention. So we wanted to document that we could use with our students, which would help them track their progress. So I worked on over the summer a wellbeing document which has a beginning, middle and an end. And we use with students as soon as they, or just before that they start or enroll on their course in September. And it's a series of questions which does involve, and it's looking at the whole college or learning environment. So it's how do they feel at the beginning? There's various kind of adjectives that they can use, whether it's happy, nervous, anxious, able to cope, lots of things that they can kind of circle. Then for the rest of the questions, we use a Likert scale, where students will, you know, for questions around travel, how is travel to college? Because I think it's, we need to kind of make sure we look at the whole picture for students. And a lot of our students are very nervous, understandably, around travelling during rush hour, busy times, school kids on the buses around the bus stop make it really difficult. As well, for people who've just recently come from the ward perhaps, or haven't been in anything for a very long time, you know, travelling to college can be a very unnerving experience. We look at the enrolment process, engaging with other members of the staff. It's not just around talking to a tutor. Are you able to ask a librarian a question? Do you use the library? Do you use the college canteen? So we've got a list of questions, and then at the end we ask them about how they think their mental health is. And like I said, going back to it having a beginning, middle and an end, students are able to review this 3 times throughout the year. And what we are seeing is that students who were very nervous, very anxious, and rated themselves very low on the Likert scale, coming towards the end of their course, we're seeing higher numbers, and we're seeing them circling able to cope, happy, meet new people. So it's something. Health services. And yeah, and also in terms of the mental health services, it's you know, reduced medication, come off of medication, left my community or discharged from the community mental health team, or perhaps not accessing services as much as I was before. So although we're not using a document from or mirroring anything particularly from IAPT, yeah, it's something that we've developed in partnership with the teachers and also the students, because the students were involved in designing this as well.
Erica, thank you for that. What I want to, what you've just opened the door to, okay, wonderfully, and without any prep by us beforehand, is it probably at this stage doesn't matter that we use different tools to the tools that you're using. What was quite important in what you said is that clearly you have a process with a beginning, middle and end for learners. And it has many of the questions that we ask, not just on those tools, but on a survey that we've designed, which again did involve our and some learners in it. what is interesting is that many of our pilots are really struggling with the concept of asking learners who they see as vulnerable questions and overwhelming learners. So tell us what the recipe is that you use for being able to collect what sounds like the same amount of data as us, but without all the grief.
I think really it's the approach. That might sound like a strange thing to say, but it's the approach. And also there's a buy-in for the learner also. It's not just we're taking information from them. It's kind of a two-way thing. Because the learner can also document their journey and travel throughout this document, so they can see the highs and the lows of their journey. And I think we actually struggled with the same thing, to be quite frank. And when we looked at the questions and the number of questions, etc., we felt, gosh, students have enough to do. And in education, they're questionnaire out in particular. So what we did was we had a focus group with students with mental health issues. We put on a nice lunch. We had pizzas and nice things, to eat and stuff. And we went through some of the questions that we were thinking about asking. And our learners were quite vocal and saying, no, I find that one offensive, take that one out, you need to add this one. So I think in terms of the sensitivity of it, it was important to work collaboratively with students.
But also, I think, probably going back to what you said, I think we've got a captive audience in that we get referrals throughout the year. Particularly, we do see a surge during the summer term because John and I are non-term time, so we're here throughout the summer, which is one of our busy periods. So that's when we're going into the community mental health teams, onto the wards, and obviously our work with students, but particularly focusing on staff, making sure everyone knows who we are, what we offer, where we are, how they refer. And we're trying to make sure people are getting their clients in pre-September. So we're meeting with people throughout that period and getting people, exploring people's options and getting people ready to come to college. So during that time is a fantastic time to meet with students, find out what it is, and then, it also informs their college and how we can support them in the college. So yeah, hopefully that answers the question.
What difficulties are your projects having?
I think it is similar, John. It's not. It hasn't been a particular surprise to me, except for, and it would be really good if other people chip in. But except for the sheer sort of volume of the disquiet, and it is that I think that last week we got Catherine James to present that original work again, because it felt like people had not looked at the evidence base. So they've not looked at the stuff that you've done before and is published and is available. They've not looked at the work that Catherine had, and not realised that Learn to Be had come out of that same process. So maybe to everybody else, I should say that many of us have been doing this for many, many years together, and there are similarities and differences across the piece. So the IAG had got lost, John, I think is probably what I would say, for a lot of pilots. They weren't doing it as IAG, therefore they were doing it very often as a paperwork exercise like you would in other courses maybe. So that was a very real difficulty. The other thing people had lost a little bit of sight of was where to signpost people to. And I think there has been an issue about, because the courses are potentially free and are free for anybody, if people want to. But I think people felt that people were coming in and saying that they wanted access to a free course, and so they were, engaging them. But I genuinely think the biggest problem, and I've just noticed, Jessica, your hand up, so I'll let you in a second. I think the biggest problem was that PHQ9 asks a question about whether people have self-harmed or thought about self-harm or suicide. And for many people, bearing in mind that most of the pilots that were selected are people who've not done this work before, particularly. For many of them, that was a step too far in terms of their own stigma, if you like, so their sense that if you ask a question about suicide, either it will tip somebody over the edge, make things worse, or their sense that they wouldn't be able to handle what somebody says to them. And I think that's the journey that we're still on. The problem for the pilots is, it's going to sound terrible really, but we only had a year for them to make that journey. And now
Sure.
we desperately need for the next phase for people to be able to ask the question, because if they can't, it means that we won't get the evidence that we need. And that's the very real problem, is that, as you know, it takes a while for people to change their mindset around mental health. But in this particular project, we don't necessarily have an open-ended time frame for that sort of change. Jessica, did you want to chip in at that point?
Well, yeah, I was just reflecting, and it may just be peculiar to our project, but I was interested in what John and Erica thought. Is that I've worked in mental health for a long time, and this was sort of coming back really. And I found that the tools that we use, the PHQ and the GAD and the short WebWebs, they sit really nicely in a conversation, in a useful conversation, for most people. Then when we put in the sort of the well-being indicators, or in the wider survey, I've got a bunch of people who are doing quite well, and they will just whip through that, and that will be fine. And then I have another bunch of people who really been beaten up by whatever system they're in, and they're quite traumatised. They're quite passive, and they will do it as well. Yeah. There's a bit in the middle where everything's just a little bit a bit more fragile, and I can do and the team can do the mental health questionnaires. That's okay, because again, it sits in a conversation, and we put some training around the suicide question and how we respond then if, we've got a plan around that, and that's all, well, it's not okay, but it works. So it's just this middle group, and then the wider survey that I actually feel like I have to I have to, force myself, because they're neither particularly active and they're not particularly passive, and it's all just a bit wobbly in the middle, and I think they might be the majority.
Sure. I mean, we see that also, I think. And sadly to say also, I think with some people that we see, they're eternally grateful, and they want to answer the questions to think that's going to please you. And it's really difficult to get that point across to individuals to say, look, we'd like you to be honest, as honest as you can, in terms of how we can do things better, or how the college can do things better. I think, and also one thing comes out of these wellbeing indicators that Erica has, is that if we can also see when a learner's struggling. So if they're ticking the box that at the beginning that they don't mix well in a group or don't work well in pairs, and they're still ticking that box midway through, there's alerts that can come out of that for us, so that we can work closely with the support services in the college and the teacher to make sure that the reasonable adjustments that individual needs is in place. But I think you're right. We have also the same thing, where we have a group of learners who I think just tick.
I think whilst you were talking, I thought actually I could probably borrow from what you do in the inpatient settings, because at the moment we have an initial IAG, and we kind of feel we need to try and get through all of that. But actually, I think I might try and split that up before people go on courses, because then that just takes the pressure off everybody, I think. And it also means that the people who don't have the range of scores that we want, we can then signpost without having to put them through the that sounds awful, Katina, put them through the survey. I don't mean that. Process them through that survey. So that's been really useful. Thank you. That's really helped, actually. Thank you.
You're welcome.
I think you're quite right there, Jessica, but I was talking to Richard Probert, who had Ofsted last week, so he wasn't at the meeting, so he rang me this morning to kind of find out what he'd missed. The Ofsted went fine, by the way, he's saying. And IAG is a big feature of their project. And that's exactly what they do. They do the kind of IAG and the PHQ-9 GAD-7s for everybody, and they capture that. And then for those who are going to do a course, they have another conversation that is about using the survey then. And he describes no problems really. What he's trying to work out now is what percentage of people does he find are too sick really to kind of come on a course immediately, so that he can work out his marketing or his recruitment, because if it's more than, say, 20%, that's a lot of their energy, and maybe they're not kind of recruiting very well or very clearly. Or maybe the demand locally for them is that, they've found a rich seam of people who need support, and the
Yeah.
signposting is important, but a bit like your service, John, that probably the health service needs to contribute to the funding of that. So he's rigorous about capturing that, so that at the end we can say, look, there's a lot of people who are not in touch with services and who we signpost, and otherwise you wouldn't get those people seeking help. And that's him building local evidence for, I guess, devolution or for whatever comes next, really. We don't lose that. And that has been a key bit of what you've done. I mean, you've presented some figures to us, but I know that over all the years, you've got this huge legacy of data, and you've also always given that data back to all the various players. So
Absolutely.
they
Imperative.
well, you would hope, apart from the current situation, you would hope they can't run away from
Sure.
that evidence. Yeah.
I think, one piece of evidence that I think we've done in the past, or looked at doing in the past, was looking at how much it costs to keep a person in mental health services versus how much it is in terms of having a student at college. And so our partners can see that the intervention that we provided is, for some people, stopping that revolving door. So we know, like, for instance, for patients in Hackney, in an inpatient setting, for basic services, it costs £350 per day per patient. That doesn't include any kind of psychological therapies or any occupational therapies that they're getting. So if you can get that data around how much it costs versus how much it costs to keep a student in a college, that can be useful. And I think that originally that gave us some leverage, so that because when we first started working with the mental health services, some of the consultant psychiatrists on the wards felt that we would make their patients more ill by introducing them to college life. But once they started to see the success of the service, of individuals improving their well-being and mental health, not using mental health services as often, and recording that kind of data, it kind of like, it pricks up their ears a little bit. You get their attention.
That's really useful advice for people. Helen, you've been very quiet, and I'm really aware you're not one of the pilots. Have you got any questions?
No, I'm fine, thanks.
Okay. Anybody else got anything else they want to ask John or Erica? I mean, it doesn't mean they're going away and you can never speak to them again, although I think I did say something in my email this morning, on my bulletin, that this was your chance. When do you TES Awards? They're in April, aren't they, John?
Yes.
So that's when you'll know, is it, if you're a winner?
Yeah, it's on the night. Yeah, so
you want us all to be rooting there for you and for mental health?
Yes, please.
As well. Absolutely, we will be. So we'll be kind of watching that. Have you got one more slide with your contact details? Do I seem to remember, or am I dreaming that?
Yeah, I've got this one.
There we go. Okay, so if people